Carol GRAYSON was with her husband Peter when he finally lost his battle against HIV and Hepatitis C.
And he just thrashed around for about 4 minutes and then died. But it wasn't a peaceful death at all.
Peter was infected by the blood products used to treat him for haemophilia. For years they tried to find out how this could have happened. All they knew was the blood product came from America. But recently, Carol traced it to this prison in Arkansas. With the help of American lawyers, they matched the product batch numbers. Inmates here were paid $7 a time to give blood. An American documentary maker found that high-risk donors weren't always excluded.
Drug users was also allowed to bleed. People that shot up different type of drugs. You can see these same people participate in homosexual activities and then going over to the blood bank and bleed, because I was amongst them at all times.
The prison service denies any wrongdoing, but infected blood products were exported to the UK in the late 70s and 80s. At first, there was no evidence of viral transmission through these products. But the risks became clear. They were acknowledged by the government, yet the imports continued and the problem products weren't recalled even after safer, heat-treated ones were available.
I want to know why my husband received prison blood, and so do all the other haemophiliacs. We've had over 1,000 deaths now in this country, and there will be many more people dying of HIV and Hepatitis C. And we want some answers.
This lawyer in Scotland is acting for 90 haemophiliacs. He believes it's against human rights law to refuse an inquiry and that patients deserve the full truth.
What the government should do is hold an inquiry where people be cross-examined, witnesses led, documents obtained, get everything into the open and transparent so that people do not think there's a cover-up.
Because right now that is what some victims think. They can't understand why the Department of Health has continually refused to have a public inquiry, especially as they know that some key NHS documents have been destroyed from that period. And they know that in some countries there have been investigations that have caused heads to roll. The Department of Health refused an interview, but in a statement they said the government of the day acted in good faith, relying on the technology available at that time. Therefore, we don't feel a public inquiry would provide any real benefit to those affected. People like Andy Gunn can't take this response seriously. He just started school when he was infected with HIV and Hepatitis C. He's grown up with unanswered questions and he doesn't want to die that way.
I never thought I would see my 18th birthday, you know. And every year I wonder if it's going to be my last, you know, and it's a hell of a way to live. But I hope so. I hope I do see some kind of justice, you know, so that, you know, we can at least die with dignity.
It's frustrating still fighting for information, but they want to know whether their infections could have been avoided. Gill Higgins, BBC News.